Good afternoon, everyone, and good morning to those of you joining us from out west. My name's Christiane Schofield. I am the project manager for the Spotlight on Invisible Disabilities project. As many of you may know, the Spotlight project is funded by the Government of Canada's Social Development Partnerships Program, Disability Component. It is a joint venture of the Canadian Hard of Hearing Association and 19 partner organizations. It was created to provide recommendations to the federal government around creating accessibility legislation. We're grateful to be working with such a dynamic and diverse group of organizations and the people that they represent. Through consultations, surveys, and webinars, Phase 1 of the Spotlight project gathered thoughts and experiences from Canadians with invisible disabilities. This culminated in a report to the federal government this past March. Our goal here today is to build on the work that we've already done through Phase 1 by developing concrete steps the federal government can take to address accessibility gaps. This is the focus of Phase 2 of the Spotlight project. More specifically, today we're delving into youth perspectives and how we can ensure that attitudes towards people with non-visible disabilities change. For those of you watching, if you are having technical difficulties at any time, please let us know through the Q&A box on the right-hand side of your screen. Our technical team will be happy to help you. As well, we encourage you to submit questions for our panelists through the Q&A box as well. Before we get things started, I'd like to present a short video capturing some of the important work the Spotlight project is undertaking.
That's one of the things about hearing loss. It isolates you from people, and in order to be confident in ourselves, it helps to form strong bonds with other people who are in the same shoes.
For those of us with invisible disabilities, being mental health, hearing loss, learning disabilities, our needs are not being met because they're not visible, but they're every bit as important.
And you come into a conference like CHA, and the message is, yes, we can. It's okay to have a hearing loss. It's okay to ask for help. It's like this elephant is off of your back because you can just be who you are, and you don't have to measure up. You don't have to try to fit in with the hearing world.
And the stigma is more about how they criticize me or judge me, how they discriminate, and how that affects people. Stigmas affect people. And I think that the reason why we have them is labels. And if we can get rid of the labels, then maybe the stigmas will go away.
People who come for the first time are totally blown away. They're not alone. They see 100 people around them who are like them. And they would say, I had no idea that there were so many people out there like me.
By coming to CHA, I wanted to help people realize that their struggles are not unique. We all have our own disabilities. Everybody has something going on in their lives. Everybody has their own story. And together, we can kind of build that awareness around this invisible disability so that people realize it's not really invisible, it's there.
Preparation for employment. How do you handle that interview? How do you get through that door?
When we asked employers why people are not hiring people with disabilities, fear of the unknown and a lack of awareness of the abilities of people with disabilities were the two number one reasons.
We need to prepare everyone who is seeking employment to understand what it means to be accommodated.
And I think that a really number one priority is to build that understanding and empathy for anyone living in this country, to be patient with the different needs of people.
So join us.
Join us in making Canada inclusive.
In making Canada more accessible.
A truly accessible and inclusive society for all of our benefit.
Join us in making Canada more inclusive.
I hope you all enjoyed our new video. And now I'd like to introduce Ryan Williams, who will be facilitating the conversation today. Growing up, Ryan was able to remain active thanks to 50 surgeries that helped ward off a rare condition. Ryan's no-quit attitude and love for the game of hockey propelled him to remain healthy and fit. No matter the challenging journey, Ryan used his health and wellness knowledge to educate others on the benefits of biomechanics and human kinetics. He is no stranger to life challenges and has experienced firsthand the impact of cultural attitudes towards disabilities, especially those that aren't visibly noticeable. In addition to working as a personal trainer, Ryan is an advocate and spokesperson for those living with disabilities. So I give the word to you, Ryan. Welcome.
Thank you, Christiane. As Christiane mentioned, we're delighted to have our panelists and you, our audience, with us here today to tackle this important issue around changing attitudes towards people with non-visible disabilities. I'm looking forward to our conversation with you all today and you, the audience. We're going to start things off with a dialogue amongst our panelists and then move into a time of questions and discussion with the audience. Our panelists today include Ainsley Latour, representing the Canadian Hard of Hearing Association, to my immediate left. The Michaela Burton, next to her, with the National Educational Associations for Disabled Students. Brittany Johnson, next to her, representing the Canadian Council on Rehabilitation and Work. And finally, at the end of the table here, Martin Bauman with the Canadian Mental Health Association. We're all looking forward to a rich discussion. I'd encourage our audience to join in by asking questions and sharing your thoughts using that Q&A box on your screen. We'll have plenty of time toward the end of the session to get into your thoughts, comments, and questions. We'll also have polls coming up throughout the webinar. We want you to participate, so please keep an eye out for those. We will do a sample poll right now so you can get a feel for it. And the poll should be appearing on your screen right now. I'll give you a few seconds to submit your answer. Pretty simple one. Where are you from? Where are you joining us from today? Please submit the question again through the Q&A box. And if you have, if you have any technical difficulties seeing the question or submitting your answer, submit a question in the Q&A box and we'll have one of our techs help you out with that. So we'll now take a look at the poll results. Looks like 42.1% of you are from the east side of Canada, 15% central, 31 joining us from the western side of Canada, and 10% from outside of Canada. So for those of you from outside of Canada, please feel free throughout today's discussion to let us know how things are being dealt with in relation to the topic in your country, and we can maybe expand on that with how we feel things should maybe be going here. Maybe there might be some valuable tips you have for us. But to kick things off, I'm going to ask each of our panelists here to talk briefly about themselves, their organization, and their lived experience with a non-visible disability. Ainsley, would you like to kick things off?
Sure. Thank you, Ryan. I am very happy to be here, and I'm looking forward to the conversation that we're going to share this afternoon. So to get the ball rolling, my name is Ainsley, and I have been an active member of the Canadian Hard of Hearing Association for maybe about 10 years now. And within that, primarily, I've focused on the Young Adult Network and have assumed a lot of leadership roles within that group. So my invisible disability that brings me here today is hearing loss. And with that in mind, I'm also an experienced teacher of the deaf and hard of hearing. in the K-12 sector, and currently I'm working in an allied healthcare profession in genetics here in Ontario. So I have quite a diverse number of experiences to share with you.
Great. Michaela?
Thank you, Ainsley. Thank you, Ryan. Thank you, Brittany. Thank you, Martin. My name is Michaela, and I work for the National Educational Association of Disabled Students. Briefly about myself, I'm an advocate for people with disabilities. I'm involved in volunteering in Toronto, where I currently live. I'm an advocate for equality and equity. I think these are principles that should be guiding a lot of the new upcoming legislation. I personally identify with hypermobility in my joints, complex PTSD, concussions, and ADHD. So I can speak to these experiences today in terms of accessibility. With regards to the National Educational Association of Disabled Students, we provide and work on accessibility for students and graduates who identify with a disability. We do that through different projects. We provide resources for students who are in transition periods to post-secondary and out of post-secondary and during their post-secondary experience. And we focus on debt reduction and different pieces like employment as well. So yeah, thank you.
Great, thank you.
Hi, my name is Brittany. I am representing the Canadian Council on Rehabilitation and Work, which is basically an organization that allows you to gain access to employment. The disability that I am here for is I have lupus, which is an autoimmune disease that causes your immune system to attack various parts of your body, as well as I have epilepsy, which I have two different kinds of seizures. One is your general tonic-clonic seizure, and the other is focal seizures, where I just generally tend to stare off into space. I also have a disease called Meniere's disease, which is an inner ear disease that causes vertigo. And another disability I have is something called acute disseminated encephalomyelitis. Can't spell it. Basically, it causes inflammation in the brain. So I have lesions on my brain that cause brain damage, and I'm happy to be here.
Hi, I'm Martin Baum, and I'm here on behalf of the Canadian Mental Health Association. I could go on for a while, but I'll try and keep things brief for you. Mental health has played a huge role in my life, and I continue to see it day after day. I was 10 years old when I first came in contact with it. I lost a cousin to suicide, and seeing the toll that that takes on a family, my own family, was a real wake-up call for me. A few short years later, I saw my dad go through a major bout of depression, and again, that was another wake-up call and experience of realizing how close somebody can be to you and not see the signs that somebody needs help, can't feel like they're able to talk about it. And in the years since, I've seen so many other close friends and family deal with issues of depression or anxiety or self-harm or other issues of mental illness. In my own experience, I relate most closely to social anxiety, feelings of self-worth, times in my life when I didn't feel like I had much to contribute in a social setting, feeling like I put a lot of, I think, of my own self-worth and other people's approval of me and what they thought of me, and instead of instilling in myself that sense of value. And so those are the experiences that I came from. That all kind of culminated for me last year. I did a bike ride summer of 2016 from Vancouver to St. John's, riding a bicycle across Canada to raise funds and awareness about mental health. And since then, I've started working with the Canadian Mental Health Association. So glad to draw on those experiences today.
Great. Thank you, everyone. We obviously have a lot of, we can expand on all our personal experiences, but a lot of wisdom as well towards the topic, and that's great to see. Now that we've all introduced ourselves and we can move on from here, we'd like to get on with the topic of changing attitudes towards people with non-visible disabilities. And Non-visible disabilities pose a particular challenge around changing attitudes. It can be hard to change attitudes towards something that's not immediately evident. I'm curious to know from each of you, should non-visible disabilities be included as a general awareness or dealt with as a separate entity? In other words, should a disability just be a disability? And how do we make accessibility a part of everyday thinking so that all disabilities are viewed equally? Michaela, why don't you tackle this answer first?
Right. So I think that when we think about accessibility, I think that discussing non-visible disability, there needs to be an awareness about the very particular barriers for the non-visible disability segment. And so when we talk about this, I think the ultimate goal is to say that we need to build awareness around our particular experiences in life that involve our actually, I can get to this point later. I think right now we do need to generate the particular awareness around the particular barriers, and this involves a complex set of factors. Each micro context right now, we are facing, I'm using my experience, different particular facets of power that are causing the a particular barrier that is complex. Sorry,
That's okay. So,
you can come back to me.
So I guess just how can we make accessibility, in your experience, part of everyday thinking and your particular experiences? How can we make them viewed a little more equally with other disabilities?
Well, I could actually build on what Michaela was saying. To do with, I think you mentioned the complexity, right, of individual experiences. And I think that's part of the challenge in trying to group things together, in grouping invisible disabilities and just visible disabilities together. You lose some of what makes those experiences unique. And I think that can be a challenge. You don't want to erase somebody's personal experience. But I do think there can be, on the other hand, some solidarity and strength in being able to connect with other people who are going through what you're going through or similar experiences, and that you can gain a sense of strength and a stronger voice, maybe a stronger sense of community and belonging by being brought together with these people. And so in that case, if you are lumped together with people of different backgrounds, I think there can be a benefit there too.
I have it now.
Okay.
To
Please
build
share.
on that point. There are some transition supports going on right now. We've spoken about transition supports a lot, Ainsley and I. I think that the idea of supplementary advocacy, sometimes there's a big focus on self-advocacy, and that's actually something that has happened a lot in my experience. I have to self-advocate for just the most basic of needs, and that requires time, that requires energy, that requires above and beyond what I think is a requirement that ought to be expected. And I think that with regards to awareness, I think that what needs to happen is coalition and allies. I think that we need to see people stepping up and saying, I have hired a person with a non-visible disability. I have worked with, I have done this. This is a pragmatic approach. I think that we need to move away from sort of the notion that this is a sort of a celebrity approach. We need to see more of a combination of people saying...
just everyday people coming forward and saying that they have worked with someone or have hired someone.
supplementary
It
advocacy.
doesn't necessarily have to be someone frequently in the public eye.
Yeah.
Yeah. I like that. Great. Would you like to expand on that at all, Ainsley?
Yes, I would. Thank you. So the idea that if you have an employee with a non-visible disability who's done quite well in their field and now they've moved up in their field and they're at the point where they're hiring, you can use that person as a person to mentor employers who have never hired someone with an invisible disability. And this is sort of a reverse mentoring process that would work to support the employer in their process of hiring people with non-visible disabilities. But also on the topic of transitions, I think that Michaela and I have discussed this at length, and individual advocacy is really important, and people with non-invisible disabilities have a choice whether to disclose or to not disclose, and then they have to advocate very hard, strongly, because it's not obvious and their needs aren't obvious, and they often get overlooked and missed. And the pressure from that and the pressure from the system and that extra weight on them often can lead to mental health concerns, and these are very inherent, in particular in times of transition for graduates, students, young adults, and young adults at heart. And I think we need to work on focusing supports on those transition periods, particularly after students leave school or they're between school programs or between jobs, so that they can continue to be successful, and their success and their advocacy in that success will work to change attitudes just by raising awareness. But if those supports aren't there for the mental health issues that may develop secondarily as a result of trying to advocate and work within a system that's not designed to meet their needs, or not designed with their needs in mind, then it's harder for them to be successful, which doesn't do anything to remove any barriers.
Absolutely. How about you, Brittany? Would you like to expand on it all?
I completely agree with the self-advocacy, just based on my own personal experience. I was diagnosed with lupus as an adult, and so prior to being diagnosed with lupus, I worked in a special needs camp, helping teach individuals with disabilities kind of everyday tasks and how to complete them and be independent. So after being diagnosed, it was difficult for me to get back into the workforce because I didn't know how to approach the situation. It was new for me. I had to learn about the disease itself. I had to learn how to function with the disease and how to cope with the disease. So that's why I found that going through the CCRW, it was easier because they taught me skills and they gave me ways to approach the situation. Just trying to find gainful employment was difficult when I wasn't with them, because I didn't know how to, when going to an employer, I didn't know when was the correct time to disclose my disability or if I should even disclose it. So I found that having someone there to help you transition from not working to working, or even transition for healthcare as well, having someone there to support you is very important.
Support network for sure.
Yeah.
Michaela?
That's actually a really great point. So for the non-visible disability experience that I've had, not only is there the idea and the notion of you have a circle of care, a circle of health care that you would like to maintain. There's also the idea of your social space. There might be the idea that you'd like to engage in an aspect of your life that you identify with, your social identity. You need to meet your basic needs. And to self-advocate and to try to support yourself by integrating yourself into environments that might not inherently recognize who you are, what you need, and to insert yourself into these environments and literally make yourself vulnerable and express yourself and say, you know, this is not meeting my requirements. I'm trying to convey this to you in an honest way, to not be demanding, but I'm just letting you know this is what I need. It's an accommodation. Is it okay if I ask? It is such an uncomfortable conversation. It's at times traumatizing because that power dynamic, depending on where it is, what it's for, over and over and over, each micro context that you're doing this in, that can be determining of your health. That can be determining of your life trajectory. It is so determining. And so when we are talking about self-advocacy, this is something to sometimes just meet basic needs, to sometimes just participate, to sometimes have a sense of dignity. These are very important things. And that's why when I initially answered your first question, I just had so many thoughts going in my head because...
Well, and I think we touched on a few things there, and we all, I'm sure, have many things we'd like to say in regards to that question, but I think the biggest thing we just touched on is just self-advocate, speak up, don't be afraid to, and that's probably the best way to gain accessibility.
Yeah, and that can be a really hard and scary thing to
Absolutely.
do if you're somebody who's applying for a job, or if you're somebody within a job. Maybe you're applying for school and you're in a competitive environment where you're trying to get a position no matter what sort of scenario you're in. It can be scary to disclose what you're going through. I think that's certainly not unique to mental health concerns, but any invisible disability. But something like sick days, being willing to, for a mental health case, be willing to say, I'm not feeling like myself today. I need the day off, or I need a week off. That can be a lot harder thing to do when all you have is your word, essentially, to go by. You're not seeing the physical symptoms portrayed, and so that can be a challenge. I think a challenge that anybody with an invisible disability faces.
For sure. All right. Well, we're gonna move on to another poll question. Actually, it should be popping up on your screen shortly. Please take a moment to fill this out as we move to the next question for our panelist. So the question is, do you feel that one national program or campaign on changing attitudes could address all disabilities? Yes, no, or maybe? And we're going to wait for the answers here. If you haven't had a chance to answer yet, please do. We are waiting to see the results, and we do want everyone to get in on this so we can feed the discussion. Just waiting here. Do you guys... Oh, here we go. Looks like 50% feel no is their answer, and 25% yes, 25% maybe. So thank you once again for inserting your answers there. Do you guys want to touch on that at all? How do you feel?
I got one more thing to say. I think the challenge with grouping things together is again that erasing of experiences, but also there's a discomfort, I think. You don't want to be seen as your disability. You don't want to be reduced to a label, essentially. And that can be a challenge, I think, that we see a lot in our culture, is when somebody does disclose what they're going through, they lose themselves in that process. People start to treat them differently, and everybody just wants to be treated the way that they are as a human being. And I think that's what we need to remember most in this scenario, is to remember the human in this case. Yes, they have a disability, and we should be mindful of making accessibility a priority for those people, but not to forget the human at the center of this, and to acknowledge them as a person.
Yeah, absolutely. And I think that kind of touches on our next question here. When it comes to campaigning and programs that are designed to help change attitudes towards people with disabilities, that does kind of throw a label on what it is you may have on a national level, both visible and non-visible. We've seen initiatives on social media and public awareness campaigns, all with various degrees of success. But in light of these initiatives, how can we as Canadian youth raise awareness and create attitudinal change, both in short and long term? What collaborative models can we implement, and what works when it comes to changing attitudes? As our panelists are thinking about their answer, I'd like to remind our audience to use the Q&A box on the right side of your screen. We've seen some questions come in now. We will get to them. Even thoughts or remarks, doesn't necessarily have to be a question. It might be something you just feel you'd like to share with us. We are keen to hear from you. So back to that question, I'd like to, Brittany, start with that, please.
So for the campaigns and programs, I think what could be helpful is, for one, providing support groups. For instance, for me, when I was diagnosed, I researched the disease and I looked at support groups. So I looked at the lupus organization, and I found that within the support group there is a lot of opportunities to learn about the disease, learn about yourself, and kind of learn about some techniques to cope with the disease. I feel like even mentorship programs is helpful. So, for instance, a lot of people that are now getting a lupus diagnosis, I find that being able to have someone there to support you that has been through something similar to what you've been through is also really helpful. So I feel like having more, or even just more campaigns and awareness programs. So you see stuff about campaigns about like mental health. It would be nice to see more of campaigns and advertisements about other disabilities. And so, for instance, I would like to go on a subway and see something about lupus, but you don't see that often.
Mm-hmm. We were talking earlier about you do have a few disabilities, and the awareness of those and the understanding from the general population has kind of changes people's outlook towards what it is you may disclose to them. If you were to tell them you have epilepsy or Meniere's as opposed to lupus, it might change their reaction or I guess their acceptance of what it is you're trying to gain from the conversation. But we wanted to say something, Martin?
Sure. You know what? Based on what Brittany was saying, I think you're right that support groups, the benefit that can bring, because it can be a very isolating experience. I think especially with an invisible disability, you may feel like you're the only person in the world that's going through that experience. But the minute that you can see other people who have similar experiences, that sense of belonging that comes from that is tremendous. Speaking from my own experiences, when I was biking across Canada, this was something for me, mental health. I hadn't really talked about much of it beforehand, but in going across the country and in starting to talk about it, I would be staying with hosts or I would just be meeting people along the way and talking about it. And the sense of relief and connection that I could get from talking to other people, they would have their stories to share with me. And it became a bonding moment where I was getting something off my chest and feeling better for being able to share who I was, and they had the opportunity to do the same. And it just created such a deeper connection. I think that space of belonging, peer support, we can be such a tremendous resource to each other. And I think that is something worth remembering when we're thinking about how we can create changes.
Now, do you think campaigning can help with that with someone who may not have or experience mental illness?
I think being able to put a human face to it, even if you're right, not everybody does experience an invisible disability of some sort, but if you're able to put it to words and relate to them, talk to them, they might be able to have a better understanding at the end of the day, because I think that's ultimately what it's about, is people fear or they're apprehensive about the things that they don't know or they don't understand. But the minute that you are able to talk to somebody, then they say, oh, I know Martin, and I know what it's like now for him to go through this. It takes away some of that fear for them of just not knowing how to respond to somebody. And I think that's the work that we can do if somebody has something like lupus or another disability that's not talked about as often. The minute that you familiarize somebody with that, it just creates so much opportunity for that connection and attitudes to change.
Great, thank you. Ainsley or Michaela, would you guys like to input?
Yes, so I want to just switch topics a little bit and talk about education. And we know that for youth with disabilities, many of them are in school or they are in some sort of training. So that could be an undergraduate level program, a graduate program, professional program, a college program, something or something else that involves some sort of training where someone is evaluating them and assessing them on how well they are able to achieve what it is they're supposed to be learning. So that, I think, the students in those programs and the graduates can actually, they do encounter a range of attitudinal barriers in that environment. And I want to talk specifically about one idea that I think could potentially improve the attitudinal barriers around educators, so that students will have a better experience in obtaining their educations. So one of the attitudinal barriers that students often come across, or recent graduates, in any program at all, if they have a disability, is generally referred to as the gatekeeper function. And this is where, based on the experience of the educator or the trainer or the faculty member, whoever it might be, they assume because of the student's disability that he or she may not be able to do the job, and therefore they should not even bother going through with their training, and they shouldn't be accommodated because they can't possibly be accommodated in the workplace in that fashion. And often that is a judgment that's not necessarily the case. And so the way I think we address that is we need to talk about essential requirements. And for those of you who are in the K-12 sector as educators in Ontario, we usually refer to those as curriculum expectations. But in post-secondary, we're going to call them essential requirements. And those generally refer to the skills or the knowledge that a student needs to have that are actual prerequisite, bare bone stuff that they need to be able to do or have when they graduate that program. And it can mean that a specific skill has to be demonstrated in a specific way. So for example, in science, maybe a skill is being able to measure something using, I don't know, a pipette or a graduated cylinder. And if your student is blind and they can't actually see the numbers on the cylinder, do they need to actually be able to use a graduated cylinder to measure something to graduate their program? Or is the essential requirement being able to design and then analyze the results of an experiment? And so the problem in post-secondary often is that there is no set of essential requirements for programs and courses that students take at the post-secondary level. And therefore, the judgment about whether an accommodation is going to modify that essential requirement is one that you can't make because there's nothing to judge it against. And so often you end up with individual faculty making that decision if they're teaching a course. And disability service providers also lack the connections to help with that or the experience because there's not a lot of students specifically in STEM. So I think we need some sort of framework for the essential expectations, learning expectations that students are supposed to learn when they're in a certain program in post-secondary. And so in the United States, there has been some work done towards this. I know that the National Postdoctoral Association has actually come out with some sort of framework for postdoctorate students and what they're supposed to learn when they are in school on their postdoctoral fellowships. I also know that in Canada, the Tri-Council granting agencies, so SHRC, which is the Social Science and Humanities Tri-Council, and the National Council on Science and Engineering in Canada, and there's another one in medicine. And they started to draft a framework for something like that for research competencies, but nothing was ever published. So I think the government being able to address some of those essential requirements is useful to change attitudes. And also, competition often can be a barrier to effective learning, and I think this is often the case for students with disabilities because they need cooperation from others often in order to make their accommodations work or to be listened to or for any number of things. So I think creating more equitable access to funding for post-secondary students in the forms of scholarships and bursaries is also a useful thing to do.
Great, thank you. Michaela, do you have anything you'd like to say?
Yeah, just to support that point, I would say that the idea that the built environment, there needs to be sort of a reflex in that if we have the available supports around us to reinforce the notion that if we have the built support around us to be able to reinforce inclusion, then it is easier. And I think that, for instance, accessibility, like I'm just thinking about web accessibility, for example. Many of times there's a lot of add-ons that you can do later, like speech to text or voiceover. And a lot of these things are add-ons. They're after the fact. They're a retroactive accommodation. You can do them later, but they're not built in. And so if some of these features were proactive, then there would be less elements of ambiguity. There would be less circulation of establishing, well, is this going to intervene with, like Ainsley was saying, the essential learning requirements? Will this foster a breach in the course of what I'm teaching versus the competition? And so when it comes to accessibility, I think that restoring equitable circumstances does require thinking about a broader scope. We need to think about the differences in expression, the differences in how we process. We need to think about a lot of the variables and the variability in how everyone experiences life, because as it stands right now, that is not the case, given that a lot of the reason why accommodation is an accommodation is that that has not happened. It's an after the fact. Mm-hmm. That's also part of the idea of universal design, in that this is a proactive design approach. This is supposed to be a wide-reaching idea of how to build proactive environments. But to get there, it requires a paradigm shift. It requires being able to include the perspective, the expressions of how there is such variability in all of our senses. There's variability in all the voices of human, and so I think that that's to support what you just said, Ainsley.
I'd actually like to talk about the educational piece again, what Ainsley was talking about. I think there's an opportunity there, especially when it comes to mental health, to have some more of those supports in place. If we're looking at who is right there engaged with students and young adults and youth when they're at their most vulnerable periods, high school, middle school, transitioning to post-secondary education, whether it's a college or universities, that's a very vulnerable time period. There are trainings there, things like mental health first aid, Safe Talk, which is more suicide alertness, Assist, which is applied suicide intervention skills training. There are programs there, and I'm encouraged to see that some universities and some schools have taken the lead in having things like their DONs and RAs trained in that, but it could be more widespread, especially I think when there are opportunities, professional development days for teachers to be trained in that, because they're getting students at a time when it's a very challenging time period. I think there's a lot of fluctuations in somebody's life, and we need to be mindful of where we can be most supportive of those students. I'll give an example of what CMHA is doing. They have a partnership with the Canadian Hockey League, and so they go in with different teams, whether it's the OHL, the QMJHL, the WHL, and they will partner with those teams individually and have the athletes trained in suicide alertness so that they're able to feel a bit more comfortable in talking about if they're experiencing a tough time, or they might be more comfortable in being a resource to each other. Same thing with the coaches and trainers. If we could expand that and apply that to other scenarios, I think we'd be doing ourselves a service.
That's a great point. I think it just comes down to educating and, again, self-advocacy as well, making sure everyone is aware of the subject, but when it comes to raising awareness to create attitudinal change, you guys want to maybe just touch on that specific question again? Just how can we go about creating that change?
I can go right back into
Yeah,
talking
sure.
again.
Sure.
I'm happy to. I think one other thing that's worth thinking about here is, especially I can only speak from my experience in mental health context, I think we've made tremendous strides, and the awareness piece is coming. It's getting there. We have a lot of people who are more comfortable in talking about their mental health experiences. I think we're tremendously benefiting from advocates, somebody like Clara Hughes, who's willing to share her story. But I also think that we have almost a two-tiered system here where there are certain diagnoses which people are more comfortable talking about. We kind of have an understanding and a comfort level around talking about depression and anxiety. They're familiar to us. We either have somebody that we know who's experienced it, or maybe we've experienced it ourselves, but there's certainly emotions and feelings that we can relate to. What we have trouble, I think, and what we need to really do in this area is there is a whole selection of other disabilities, mental illnesses, which we're not as comfortable talking about. And I say we collectively as Canadians. Things like schizophrenia, things like borderline personality disorder, bipolar, someone who's experiencing psychosis. Those things I think people are a lot more apprehensive and afraid about not knowing how to handle and deal with. And so I think that's probably the case for many other disabilities. The less education you have around it, the less awareness you have around what it is,
Absolutely.
Then that's where the trouble comes.
Great. Okay, everyone, thank you. We're going to move on to another poll question. You'll see another poll appear on your screen here. Please take a moment to fill this out as we move on to the next question for our panelists. And the question is, campaigns and programs have been designed to change attitudes towards people with non-visible disabilities. In your opinion, which approach would be most effective? Option 1 is employee training. Option 2, K-12 programs. And the third option, national awareness campaign. So please punch in your answers there. We will get the results in a second. And if you haven't had a chance to answer, now's the time. Jump in. We'll look at the results here in a second before we get to our next question for the panelists. Results are in, and looks like we have a tie between employee training and K-12 programs at 38.5%. 23.1% feel national awareness campaigns would be the most effective there. So thank you for your answers. And again, another reminder, please submit some questions or comments in our Q&A box at the bottom. We'll get to those shortly. We're now going to touch on an important part of the Spotlight project, which is making recommendations to the federal government around what they can do, both in terms of implementing legislation and encouraging attitudinal change with Canadians. Let's imagine you've got the Prime Minister and the Minister for Sport and Persons with Disabilities here with us today. If you could recommend to the Prime Minister and Minister one thing right now that could change attitudes, what would that be? I'll also actually put that question up to the audience. If you guys want to chime in on that, feel free. Martin?
Sure.
Would you like to start off? We'll go right back to you.
I think with the case of mental health, this is something, Prime Minister Trudeau has that unique experience of, he's been an advocate for it. It's something that he's seen quite closely with his mother, and he's been candid about it, and she has too, about her experience with bipolar disorder. What I think I would like to see from the federal government, and from provincial governments too, is funding. I think that's the case for a lot of these disabilities. We have support systems in place, but without the proper funding, it's difficult to provide the services there. I think the demand for especially mental health services far exceeds the capacity to meet that demand. And so you end up with wait lists, people who really need help but aren't able to get it in a timely fashion. Or maybe they get put on a wait list for something relatively smaller needs, but by the time that they're finally able to see somebody, then what they had originally gone in for, it's compounded, and it's become even more significant than it was before. And so funding is what we need in order to provide the proper staffing, to have people who are able to provide that assistance to people around the clock, to be able to fund physicians and therapists, the people that do this work and are able to help people. I think of things, what a benefit it would be if we could have people get counseling and therapy covered by their health plan so that they didn't have to pay for something like that. What if it was a right as a Canadian citizen to have free therapy? I think that would be a benefit too.
Great, thank you. Anyone have anything they'd like to touch on for that?
For me personally, just dealing with my own personal experiences, I think one important issue that needs to be changed is in terms of healthcare. Just based on my own personal experiences, I've gone to the hospital for lupus. The way my lupus works is it changes, and my symptoms change, and some changes require going to the hospital. And I find that many healthcare professionals that I've dealt with over the years, including my own specialists that I've had in the past, where you go in to get help for something, but it's almost as if, because it's not visible to them, it's not real. So I can go in for a range of things. I've gone into the hospital, and it's almost as if the health, like the profession, like the doctors, I'd go in and I see a doctor, and oftentimes I find that when I go in to see the doctor, it's almost as if I'm just there. I'm just there because I'm seeking narcotics or I'm seeking pain medication, and they don't take. It's almost as if what you're saying is not real to them, and I find that a lot of healthcare professionals need to be trained in actually believing what you're saying, and taking you seriously when I'm experiencing pain. My pain is real, and I want you to believe me when I tell you that my pain is real. So I find that there may be requiring doctors and healthcare professionals to take a course or getting further educated with invisible disabilities would be really helpful.
And just to expand on the question a little bit, question actually coming in here, what issues do you think the government will face when trying to implement a lot of the things we've talked about today and the points we've made? So for example, trying to implement some change in the healthcare system, that can obviously be a very tough thing to do. What barriers do you think they'll face?
So working more with the provinces in healthcare and education, to make sure that someone living in one city in one province has the same access to another young person with a disability living in another city or another province or going to school at in a different city or province. I think for young people with hearing loss, if you go to school at Memorial University of Newfoundland or the College of the North Atlantic, which is also in St. John's, Newfoundland, the access you have to people with expertise in hearing loss as a student with a disability is quite different than the access you have to someone in Ontario. And for students with hearing loss out there, in post-secondary, they have access to an educational audiologist who works with the accessibility office and will come in on a case-by-case basis to work individually with those students. So in Ontario, at a lot of the schools, you don't have access to an educator of the deaf or hard of hearing or an educational audiologist. So the funding for hearing aids is also quite different between different provinces, and I think along with transitional supports, it's not the case that a student graduates and all of a sudden they can afford their own hearing aids. And in some provinces, even when they're a student, they still have to pay for hearing aids and stuff, and that is a particular challenge, I think, for a lot of young people with disabilities. And it's often the case that many people with hearing loss or many young people with hearing loss, increasingly in the school system are not just sort of deaf or hard of hearing. They may have additional disabilities or needs that go along with that. So I think making services more equitable across provinces and across the country is really important.
Absolutely.
I think part of making services equitable too is being mindful that not everybody lives in cities, being mindful of rural communities, remote communities, Indigenous communities, and their needs for support for their invisible disabilities. It's something that is not unique to Canadian cities, it happens everywhere, and I think those are often communities that get ignored or forgotten about when funding is available for projects.
Absolutely. Brittany or Michaela, do you guys have anything you want to touch on there?
Yeah, to add to that point, I do think that accessibility is an unpredictable process. at this current point. I think with regards to a recommendation, web accessibility, and actually reviewing how we can integrate features that promote proactive accessibility at the very beginning. Having access to information and knowing where and how you can acquire resources that will facilitate an experience. I think that engaging with the services that you need is extremely important right now, and I think that having accessibility features included from the beginning for the online platform is something that is often overlooked.
Absolutely. We have a, would you like to say something quick? No? You sure? We have a question just came in, not so much a question, I just want to see if you guys agree with this and what your thoughts are. Vivian says she believes in the power of personal stories. She thinks opportunities of forums where youths with different non-visible disabilities can come forth to share their personal journeys. It would create attitudinal change among their peers first. Would you guys like to expand on that a bit? First of all, do you agree?
Coming from a background of journalism, she speaks right to me. Power of personal stories, I think, is tremendously significant in being able to break down those barriers of immediately connecting with somebody, getting them to understand where you're coming from. So I absolutely agree.
What campaigns do you think we could leverage on there in regards to the topic?
Well, I think different mediums, different means. I think one example of a group of guys that are doing a really good job, and it's not always necessarily to do with invisible disabilities, but talking about illnesses. A group of guys out of Halifax called Sick Boy. They do a podcast, and they're talking to people very bluntly and with humor about what people are living with. I think that's a great example of ways that you can, using personal story as an example, foster a sense of understanding, of humor for what somebody's dealing with, using levity, and it creates a connection for people who are going through that experience, who again may feel very isolated, to feel heard. Finally, somebody's heard my story, and somebody knows what I'm going through.
I think that's great, especially with the online community now, social media, something like that would be very effective, I think. That's great. So we're going to actually expand to a bit of a question and answer period here. We've covered a lot today, so I'm sure we're going to have some input from the audience here, some more input anyway. I'd like to open up the discussion to the online audience. We've had some questions come in already about what our panelists have said, as well as a few thoughts on how we can tackle attitude change together. So we're going to actually, first of all, for you guys, just what we've all said today, is there anything one thing that's stood out to you personally, something that maybe one of you have said today you want to expand on a little bit more or touch on? I know we've each question has brought out a lot in everyone. Is there anything, one thing that you really want to share or touch on a little more?
I read something recently that really meant something to me, and it was just a simple statement that diversity in Canada, in the world, is a fact, but inclusion is a choice. And people, I think, need to be really careful when they make that choice, and we need to start to highlight where those choices are so that people are choosing inclusion. Interestingly, talking about professional programs, so law, medicine, dentistry, any of the allied healthcare professions, teaching, the other professional programs that exist out there. Sometimes you have equity admission or a certain number of spots that might be reserved for students with French background or students with First Nations background, but you don't see students with disabilities in those programs very often, and the ones that are overwhelmingly have a lot of barriers that they face. So I think I'd like to see more educators throughout, all the way from K up to the end of post-secondary, in every sort of program possible, make the choice for inclusion.
That's great.
However that looks for them.
Great. Anyone else before we get to another question from the audience?
I think what Michaela said before about the complexity of each case, I think it's something to be mindful of in not oversimplifying somebody's experience, but in remembering that each person has a unique story and a unique background. And the more that we can be mindful of that, the individuality of somebody, I think that's where we benefit, is in not painting everybody with the same brush, but in acknowledging each other's, what makes each other unique, and recognizing that.
Okay.
We can never overlook the power of a kind action. And I think that with regards to what I mentioned earlier, a lot of the time there's ambiguity in situations, and really taking the time to understand each other and really get to know each other's stories. I think that's ultimately as well what will help facilitate a change. And I think that as we move forward, I think that will be a part of how we move forward in creating changes with regards to the attitudes.
Great. We're going to go to a question here from the audience. We see many successful campaigns such as anti-bullying or sustainability when speaking to recycling and paying attention to the environment, green thinking. How do we create the sensitivity that type of sensitivity towards non-visible disabilities? Great question.
I think it starts early. So students in preschool, kindergarten, very early on in their education start to acquire attitudes around diversity and around what students are capable of or are not capable of. They're certainly used to the kid in class who's always chosen last, or the child in class who has the lowest marks, or the child in class who needs to be sent out of the class because the teacher doesn't have enough support to go around, and they're acting out for whatever reason because their needs aren't being met. So I don't have an answer to this necessarily, but I just want to encourage people to look at the policies and the funding and procedures and stuff that go on in schools generally, but early in elementary school for sure, because I think a lot of these attitudes are cultivated there. And certainly, if I remember my own experience in school, we had a lot of environmental education around, I don't know, recycling and things like that, around seatbelts and stuff that maybe our parents' generation didn't really do. They didn't wear seatbelts, or they didn't recycle, and now it's sort of common practice in schools to do all those things, or for kids in cars to wear seatbelts, and no one really thinks twice about it. So it'd be really amazing to get to a place where disability is sort of thought of in the same way, but I think it takes a lot of work and a lot of investment in education very early on, because kids are very impressionable.
I agree. Yes. Do you guys think a mentorship program to raise awareness by having a guide by your side, kind of like big brothers and big sisters, do you think something like that would have a positive effect?
I actually just wanted to add to Ainsley's point, and just that point before we moved on. I think fundamentally acknowledging the human aspect that with regards to the recycling campaign, understanding that what we do moving forward, it affects all of us. We are all human. We can understand that we have at our core similarities, and though our experiences are shaped differently for different reasons, and our representation and manifestations and expressions of our senses are different, there is so much similarity. And so I think that a lot of the reason some of these campaigns have worked so well is because we understand the value of the respect for the environment, and just taking a holistic approach to really understanding and grappling with disability. I think that once we really engage with this complex process of human and environment and just some of these different variables that really shape what it means and how it's expressed and how it governs the lives of people right now, I think that we will get to the core of how we can really shape awareness and really shape a difference in how it's conducted, and implementing things like universal design and including Indigenous voice, including diversity, including all the aspects of spectrum. And I think that emphasizing spectrum and emphasizing education on spectrum, even things like mindfulness, including self-awareness on mindfulness, including self-awareness on engaging with all of our senses and coming together and talking about it and really shaping education in that way, I think that would be great. Respect for environment, respect for each other with our senses. I think that this could be a very informative practice too. So I just wanted to say that.
Great, thank you. Anyone else like to expand on that at all before we move to next question?
I think one very concrete and immediate thing we can do, and it doesn't cost any money, is think about the language that we use. We have, throughout our history, realized at times that the language we use is no longer appropriate in new scenarios, and I think that's the case for talking about disabilities and invisible disabilities as well, is learning to remember. I think it also comes back to remembering the person at the center of it. You can phrase it in such a way as a person, for instance in the mental health case, a person with bipolar disorder, not saying a bipolar person or a schizophrenic, but saying somebody with schizophrenia. It's a very simple way, just of turning a few different words around, of putting that person first, and that way you're not labeling them as just what they experience.
Absolutely. I know from myself personally, I was always very, very vocal about my own disability, and it is invisible, but at times it was very visible. But because I had that since birth, I never needed to make that adjustment of whether I should or should not speak up, and I think just growing up with it, I was maybe at an advantage to grow and develop, I guess, to the best of my ability, because I was able to start young and by letting people know what it is I was dealing with, and there was always a great level of understanding there. Had I been impacted later in life, I don't know if, let's say in my late teens, I don't know if at 28 years old I'd be in the same place I am now. So I think I'm very fortunate that it's funny to say that I had to deal with it my whole life, but I think that's a big thing is knowing that it doesn't matter at what point these kind of things, you may get diagnosed with something, it's not your identity, and you have a lot more to speak on, and you should definitely not be labeled with whatever it is you're dealing with. So great point. We have a couple more questions here. One thing I wanted to touch on, just let me pull it up. It's by Camilla. It's a question for the panel. Can someone speak to their experience? I kind of just did a little bit, but we'd like to hear from you guys of intersectional identities and its impact on living with invisible disabilities. For example, being a person of color, member of the LGBTQ community. Would you guys like to chime in on that at all? Martin, looks like you want to say it.
Well, I think in this case, I am not the best person to speak to it. I'm not a member of the LGBT community. I could be an ally in that case, nor am I a visible minority. I can certainly empathize, but it's not necessarily my place to speak in another person's experience.
Okay.
Sorry.
So can just speak on experience of intersectional identities and its impact on living with invisible disabilities. So is there
I have a couple ideas, but again, I'm also not a member of Visible Minority or the LGBT community, but I am a member of some very small communities. And I think hearing loss can be pretty isolating at times, especially when it's noisy and everyone's talking and all that stuff. And having a disability in general can be isolating in the sense that if you're dealing with any technology or you're spending time asking for accommodations or working on accommodations, that takes away from the time you have and the energy you have to socialize with your peers and do other things. And I think we don't have data on it, but hopefully that will come in a future research project, on the numbers of students with disabilities who don't identify with mental health, but develop mental health disabilities or concerns as a result of trying to advocate. And I think that's especially true for members who have membership in minority communities, more than one. So maybe they're a student or a graduate or youth with a disability, and then they're part of the LGBT community. I think because both of those two groups are so small, they're even more isolated than someone who, say, has a disability but is really good at sports and stuff. And I think can be, definitely potentially more lonely if you are a member of more than one minority.
Absolutely.
I could speak a little more to it too, and again, not from a personal level experience, but I think certainly it is the case that the LGBTQ community is quite well represented when it comes to mental health concerns because of the added trauma that they can experience in being isolated and being judged and being made to feel very vulnerable. That can often be a population that ends up needing mental health support. When it comes to visible minorities and the challenges that happen when there are mental health concerns as well, that can often cause a problem when it involves the law enforcement. And you may have somebody who is simply going through a mental health crisis, but when the law gets involved, then they are very quickly, that situation escalates a lot more quickly when really that person just needs mental health support and not to be treated as though they are a criminal.
For sure. Michaela?
I can speak as a member of the LGBTQ community. I identify as pansexual. So in my experience, I don't see gender binaries. This for me has been a process. And as a woman who identifies as pansexual and who's had a process with having a process with disability as well. There's been many different experiences in these different, like I've said over the course of this panel, micro contexts in how this has shaped my experience in life. I think that in order to create effective accessibility, we need to understand that we are humans going through processes. We're dynamic. We have an overarching culture of variability. There's many moving parts. We have so many variables to juggle. And I think that ultimately, having all the effective support in terms of time, energy, and resources, I know that it can be such a challenge. So with regards to speaking to intersectionality, I think that engaging all the different views in all aspects of our society today. We have many different parts of a global society, and Canada's in that too. I think that we really need to include all voices in accessibility and barrier-free design in order to shape it.
So, Janine, there's a question from the audience for you guys. You might be able to expand on this a bit more, Michaela, but Janine's wondering, well, she says she would recommend using a universal design approach so that you raise awareness that when building services and educational training are accessible for all, everyone benefits instead of an individual approach, which may enable continued systemic barriers. So would you guys agree with that? Anything to touch on there?
Universal design, I think, is a really useful tool, and it's important, but I don't think it's fully going to solve all of the accessibility issues you may come across, and it's just because of this complex interaction between a person and their disability and their environment and what they're trying to do and who they're interacting with. I think universal design can certainly help, but for instances of in the classroom or training or on the job, I think differentiated instruction is also complementary to universal design, and they are not the same thing, although there's a lot of confusion in the literature about them and in the research, but they are complementary, and I think that's something. Differentiated instruction is something to consider in addition to individualized accommodation and universal design, because I don't think any one of those three is the answer. I think you need all three.
Okay.
With regards to universal design, part of the paradigm in universal design is equitable use. And again, with regards to restoring equity, we need to look at equality. We need to look at the landscape and how we shape equity. And so that involves a restoration process. That involves an intersectional voice. And so we need to look at all the axes of oppression. And so we need to incorporate things like social status. We need to look at racialization. We need to look at disability. We need to include all these factors. Let alone in Canada, we need to look at how seasonal change affects accessibility. So this is my opinion. This is also my experience with disability, and also just how I think that universal design is not just, it's often equated with physical architecture, but it's very much a cultural shift in thinking, and how we can actually incorporate it and embed it in an execution. And so it requires the voice of what has been a marginalized community, marginalized communities, to be able to shape and offer the voice, the knowledge that's required. And that needs to be interjected into what is universal design.
Okay. Before we get to the next question, I just want to encourage everyone in the audience to please send in any questions you may have for the panel, or even just suggestions for how to create change. We'd love to touch on. We do have a bit of time, so please feel free to send that in. The next question, though, was from Heidi. So one of the barriers for us is being able to talk directly with persons with barriers or disabilities in order to learn to design more effectively for people. How would you suggest being able to get direct input to design? And she's the BC provincial government, so it's great input from her.
I would encourage Heidi to be diverse in who you're looking for as well. I guess from my experience as a young person with a disability in science, technology, engineering, and mathematics disciplines, I think those disciplines often get left out, and those students often get left out of a lot of things because the accessibility needs are so unique when you're dealing with technology. So I would encourage you guys to include that sector.
Great, thank you.
I think part of being able to get that sort of feedback from somebody with lived experience of an invisible disability, it requires a certain level of confidence, I think, for the person to feel comfortable in opening up and in sharing their experience. And they also want to I think, see that what they're going to share is going to have there's going to be some sort of outcome from that. And so if you can visibly demonstrate that if you're going to listen to somebody's story and not just listen to it, but then act on it and work towards making some sort of changes, if you have a reputation of doing so, then I think that creates a space where somebody does feel more comfortable to then come in and feel like they're making a valid use of their time to share, here's what I'm going through, and here's how things could be done differently.
Great, so again, just going back to self-advocacy and speaking up and really getting out there and letting people know what it is you're dealing with.
Yeah, and creating a reputation for being a good listener too, and being a good support system and a good ally for somebody with that experience, so that they feel heard and they feel acknowledged and respected when they're sharing that with you.
Great. Kayla or Brittany, would you like to touch on anything for Heidi?
Just with my own personal experiences, when I'm disclosing my disability and I'm asking for accommodations, I want the other party to be open to actually listening to what I'm asking for, and also I would prefer personally if when I'm disclosing my disability and I'm asking for accommodations, like for instance when seeking employment, I've had a position where I've asked for an accommodation, and you ask for the accommodation, and I want to have the open dialogue. I don't want to be able to just say, okay, this is what I need, because sometimes what I need, and I get into the position and my needs change. Mm-hmm. So I'd like the employer to be open to discussing.
A bit of flexibility there.
Yeah, being flexible, yeah.
Yeah.
Exactly.
Absolutely.
I'd also just like to say thanks to Heidi. The fact that you're asking the question is already a good start to know that you're willing to go down that road.
Thank you to Heidi and everyone else who's sending questions to us. Again, please feel free to send in some more. You guys have anything else you'd like to expand on that before we move forward? No. So this question is from Tara. The poll results showed majority poll did not think this national campaign was a way to educate people. And the K-9 education or at workplaces were the way to do so. Discrimination in accessibility occurs everywhere, so she strongly feels there needs to be a national campaign and all of the other educational tools for the public, as not every individual is in school or in the workplace. There needs to be a multi-approach to educating the public, employers, service providers, etc. Do you agree with that?
I think she's right. It's not any one approach that should be the end-all, be-all. It takes, I think, both a national campaign and to have education in that K-12 sector and to have education in the workplace. It's not that you're going to get the job done with any one of those, but a combination of the three is where you create real change.
Absolutely, yep. Anyone else like to touch on that?
I think a multifaceted approach is what's needed. I also think that our K-12 system, I think engaging practices that are very immediate and fostering habits that are inclusive is what will foster and generate a cultural paradigm shift. And then I also think as well that the more that we are being ourselves and really allowing spaces and opportunities for people to be themselves, I think that we will also be able to genuinely see a lighter approach in life too. I know that sounds really simple.
Yeah. Well, I think it's important that you you are very vocal with what you're saying, but yeah, just not. So to touch on what you were saying, I think Jenny made kind of touch on it a little bit with her question, but she's wondering of the pros and cons of disclosing your disability, and specifically in a job interview. So let's just use that for an example. And this, I guess, would mostly affect older population, I guess in your late teens, early 20s. But have you guys personally had any experience where you disclosed your disability and it hurt your chances at the job?
In a job interview case, no, I have not. I have been comfortable enough to speak to employers and say I'm having a really tough time right now with work, and can we make this work somehow? And been really fortunate to have that conversation. But in a job interview scenario, it can be very different. I think the pros, it is a liberating thing to be able to get that out and to be able to be yourself, to feel like you are not having to tiptoe and hide around characters of who you are or aspects of who you are. But it is a reality that hiring practices can be dictated by things like what it means, thinking about if I hire this person who has this disability, is that going to change what it costs to provide health care for them as part of their employment package? Are they going to be taking sick days all the time? What is that going to mean for productivity? And those are the sorts of questions I think some people are asking themselves, or at least those are the questions I envision in my head, thinking the worst of what if I'm going to share something with the other person, how are they going to react to me? And so that I think is the con, is that unknown of how are they going to respond to me being totally honest and sharing what I'm going through.
Great.
I think that given a context where you have what you need to do what you need to do, you would see that, and I'm speaking from my experience, things go well. I think that in a penalizing culture, that at least what I've seen and experienced, the fear, just the sheer idea that something could go wrong if I mention, I might just take a walk after an hour, just to clear my head for a second. I think that just some of these penalizing ideas and notions around what is an accommodation or what is accessibility, or I'm giving you this, so this is a gift and this is a benefit just for you. This is special. I think that it causes additional cognitive stress, and it's just a vicious cycle. And but that's the problem. We're not able to break free from that, right? And I think that it's putting so much stress. It's putting so much added pressure. And I know that at the end of the day, if at least for me, if I'm put in a position where I can do what I need to do, and I'm given the tools I need, there's a good chance that I'll be able to do the task and do it well and do it right. And I think that the pro of that is that I have the freedom. I have my basic right there, and so I think that that's being human, and that's fundamentally what I'm asking for.
Yep. Great. Brittany, anything you'd like to touch on?
For me, I feel like the pros for disclosing would be if the other party is accepting to get the accommodations that I need to do the job properly. The cons, I find in my own personal experiences, I've had a job before where I disclosed. I've had jobs where I've disclosed and jobs where I haven't disclosed. And I find that when the jobs where I've disclosed, in the beginning stages, they're very accepting and accommodating, but after a while, it almost seems like you're a burden. And then I've had jobs where I haven't disclosed, the cons where you don't get the accommodations that you need. So it's difficult to then do the job properly. So I feel like there's pros and cons to both.
And I think whether you have a disability, visible or not, there are jobs out there that aren't for you. So I think if you're in the position of a job interview, you're there for a reason. And if it just so happens in my experience, anytime I disclosed my disability, it never had any effect on. If I wasn't hired, it wasn't because of that. So I think, personally, I don't think it. There obviously is some cons if for example, my sister has epilepsy, so I can relate. There's not going to be any jobs for her in her situation where she's going to be staring at a computer screen all day. She just can't do that. So sorry, we had a few questions come in here. There's one I wanted to touch on. I saw, they're flying in now. Camilla says this has happened to many people she knows. In her perspective, it is ableism. In the employer's perspective, it is seen as a health concern. It is a loop that cannot be broken. So is it a health concern or not? I guess if you're someone who may be taking, like you said, Martin, some extra sick days because your disability is going to require you to do so, is that something that should affect your chances of getting a job or not?
Well, no, and I think also it's sometimes not even about taking the extra sick days. It's just about having the peace of mind knowing that you're able to do that the acceptance is there. And so I think sometimes it's not about, you're going to, just because you're telling this person it's okay for them to take time off when they're really not feeling themselves, I don't think they're going to go ahead and just say, oh great, I'm going to scan the system now and use up all my sick days. I think it's more about having the peace of mind of knowing, okay, they accept me for who I am and they're supporting me, and I want to do everything that I can now to reciprocate that. And I think often that means you probably don't end up taking all those sick days. It means you take it when you feel like you need it, but you're not abusing that privilege.
Absolutely. We have Viviana would like us to give examples of essential mentors who are pivotal in self-advocacy for each of us, or for each of the panel. Is there any time someone played a huge part in you?
Sure, I'll start off. My background's in journalism, so I was a broadcast journalism student once upon a time, and in my third year being a student, I was at Western University in Fanshawe College, and I was part of the radio broadcasting news program. So I was going out and interviewing people in the community, getting their stories. And Sheila Rogers is a public face for depression. She's a host on CBC Radio, a program called The Next Chapter. She was in town doing a talk about her own experience with depression, and the topic of her speech was, "Hey, that's my story too." So she was coming to town, and I knew she was going to come to town, so I got to get in touch, and we set up an interview. Got to talk to her and get her experiences on growing up and being diagnosed later in life with depression, and how she navigated that in a field like broadcasting, which can be very competitive, very high stress, and just the benefit that she saw in being able to share her experience. The platform that she had as somebody with that platform, somebody with a microphone in front of them day in and day out, and being able to share her story and the good that came from that. I think that was a big catalyst for me to want to do something like sharing my own story, doing a bike ride, being able to hear from somebody like her in the position that she's in, knowing the platform that she has and the good that's come from her sharing her story. That was a real difference maker for me, and I figured, okay, if she can talk about it, maybe I can talk about it too, and it's not so scary after all.
Absolutely, yeah.
For me, right after I was diagnosed, I started going to counseling to try to deal with it, my diagnosis. And while I was in counseling, I met a young lady who turns out had lupus as well. And so we kind of exchanged information, and she kind of was my mentor. She helped me get through it because she's had lupus for a while. So she taught me different ways to deal with it. She taught me just being able to talk to someone that's been through something similar to what I've been through was really helpful. And I still talk to her to this day, and anytime I'm having kind of a hard time figuring out something or thinking of the next step to take, I kind of reach out to her, and so that's kind of been my outlet.
And sorry, dude, just to expand on that, in any of your experiences, has the person who's helped you kind of self-advocate, have they not experienced the same maybe disability you have? Maybe just have they just been someone who's very understanding and they encouraged you to self-advocate?
I think just on that topic, on a slight side note, I think it's really great to have mentors, and there's lots of different types of mentoring. It could be a person who's successful in the field that has a disability. Maybe it's the same as yours, maybe it's not. Maybe they have multiple disabilities, or you do, and a couple of them you have in common, but some of them you don't share. Or it could be just someone who's a really close friend who understands the situation and the environment that you're in, and maybe they don't have a disability, but they sort of like are like a champion, I would call them, and that I think is very valuable too. Specifically, I mean, going through with a science background in genetics and now in an allied healthcare profession, there aren't very many students with disabilities in healthcare, and my allied healthcare profession that I'm in is so tiny. There are so few people who work in it to begin with. There are very, very few with disabilities, if any. So I was not able to find a mentor with a disability in my field. There was the research director of NEEDS actually is partially sighted, and he and I were able to connect. He has sometimes a non-visible disability, sometimes a visible disability, depending on whether he's using his cane or not. And that was helpful, but I just want to make the point about having a champion who can help you and support you can be as valuable as having a mentor with a disability.
Great. We have another question here. Would simulation programs such as interactive training modules to prepare employees to the sensitivities to those with non-visible disabilities be beneficial, or what would the challenges of this approach be?
In my case, I don't know. It's very hard, I think, to simulate depression or anxiety or complex mental illnesses. I don't think we have the technology to do that just yet. In other cases, maybe, but I would hope that it's done in a way that can create understanding without it being gimmicky and without causing maybe more problems than its intended good.
Great.
Maybe if it helps this person who's under the stimulation to appreciate or know the disability more intimately, it could help a little bit, but I think because the person and the environment and the disability all interact to make for unique accommodation needs, and we see this especially as students get higher up in education. They only have their use is somewhat limited because you do have to take individuality into consideration, and I think there's a danger of putting people in boxes in that if someone has a hearing loss, maybe you don't notice anything with their language or their speech, but their hearing loss can still be quite significant, especially like in noise, and maybe they don't wear any equipment because of the nature of their hearing loss, which is true for some people, and it's not because they refuse to wear hearing aids, it's just because those hearing aids don't help them. And their disability is very invisible, and it's almost like they're not deaf enough, but they're not hearing, so where are they on the spectrum? And I think in some instances you can flip what I said earlier about intersectionality and how maybe it's really hard and extra lonely if you're a member of more than one minority group. But on the other hand, if you're not a member of any community and you're not really deaf and you're not really hearing, or you're not really blind but you're not sighted, you're somewhere in the middle of being partially sighted, then that can be a really lonely place. So putting people in boxes, I think, is not very supportive for their mental health.
So you feel that would be the main issue with that then when it comes to simulation?
Yes, I guess I'd caution against, or I'd want to emphasize that this is just a particular flavor of this condition, but really it exists on the spectrum, and want people to be thinking openly about it.
I think it'd be very tough to simulate all the non-visible disabilities out there. You can't prepare someone to. It's I guess a mental state, if you will. You need to be accepting and flexible and understand that there's going to be many different issues potentially come across the table for those with. Michaela?
I think that investing in a sustainable approach to awareness, just to agree with the points made about the simulation, that would, by the sounds of it, be like a flavor, a point in time, not so much a spectrum of the very intricate moments of barriers that are experienced, which can happen at any point in time. And I think that sustainable awareness, sustainable education, sustainable approaches, and I'm not sure that a simulation approach would foster that.
Great, thank you. We have one more question. This is a good one. I think we'll each be able to touch on it.
I think they've all been good ones.
This is a really good one. I think it's gonna. If you could, it's from Janine. If you could give your younger self advice on living with a disability, knowing what you know in regards to self-advocacy, self-esteem, and coping, what would that advice be? I think it would kind of touch on everything we've talked about today. Kind of a good way to get into our final remarks. Is there anything you'd like to say tell your younger self? Let you guys. Yeah, Brittany.
For me personally, it would be advice for my younger self would be to not be afraid. When I was first diagnosed, I didn't want to tell anyone. I kind of just kept it to myself, and I feel like looking back, that was kind of probably not the best approach to take, just because it's important to kind of, I was afraid to tell anyone, so now I'm more open about it because I want others to know about it, and I find that when I was not being afraid would be the best approach, because I'm sorry, I'm going somewhere. Basically my advice to my younger self would be just don't be afraid. Just kind of accept what's happened to you and be open. Yeah.
I think Brittany said it. I think we can often be our worst enemy, and I know certainly in my case, the way that my mind constantly thinks and is almost overthinking can be destructive, to where you start imagining scenarios which are purely fiction and aren't based on any reality, and so that apprehension and stress and anticipation and anxiety that builds up around a social interaction, the minute that you get outside of your head and just be honest with yourself, be able to share your story, to be comfortable in your own skin, I think that's a real gift and a learning process. But to remember that what your mind is telling you is not necessarily rooted in truth, but it's telling you its own version of fears and inhibitions, which may not actually really be true. And when you finally are able to get outside of that and be honest and be candid, a whole lot of good can come from that.
Kayla or Ainsley?
I think it's really important for young people to remember that the accommodation and disclosure piece is a process, and that you may have to disclose either the presence of a disability and or the need for an accommodation several times, possibly to a few different people before you figure out a solution. So it often, I think, requires a team thinking creatively, and because of that, it's not sort of instantaneous. So it can be frustrating, I guess, while classes are happening, for example, in school, and you're still waiting for your accommodations to come and be fruitful. But just be patient and realize it is a process.
Great.
I would, just to sort of touch on what everyone just said, embrace this process. And this is a self-acceptance process, and just keep going.
Be kind to yourself.
Yeah, don't be so hard on yourself.
Yeah.
As well. And just living in the moment and understanding that no matter what, whether it has anything to do with disability or not, people are going to have their opinions. And I guess just be, I guess you're speaking about inclusion, be careful about those you include in your life and your support system. And I mean, we all have a support system. I think you need one. So to touch on everything we've talked about today, we are going to kind of we do a quick summary, get some final remarks from you guys. But I think that's the main thing is self-advocate and don't be afraid. I think is some big things that we brought out today. Is there anything else? Maybe you have a question for each other you want to touch on, or is there anything you'd like to say to finish things off with today?
Well, Ryan, I'll jump on what you just said there, and when talking about the great support system that friends can be, I'm lucky. I have great friends, and I am tremendously supported in that, and to be able to see the way that they've been candid in their lives, and the way that we've been supportive of each other, it's made it very easy to feel supported and be able to share my own story. But if you don't feel that with the people that are surrounding yourself with, find new friends. There's no point in spending time around people that are not actively looking out for your best interest. And I hear the expression often that you are the composite of the people that you surround yourself with. And if you surround yourself with good people, then you're in a good place. But if you're not in that situation, get rid of those people.
And I think it would also, too, help you forget maybe what it is you're dealing with if you're around the right people. I know in my personal situations, when I'm around my friends and those I'm closest with that understand who I am as a person, that's when my disability is something I'm not really focusing on at all. And but again, good friends or get new ones, right? Anything else you guys like to touch on? Question again, do you have a question for each other? Is there something that you'd like to open up or expand on that you maybe heard mentioned today?
I think we've also highlighted the importance of very intricate forms of accessibility, social support being one of them, and that can be a very difficult thing. It's not always simple to acquire new friends. It's not always simple to acquire support in a disability service office. It requires energy, it requires time, it requires a lot of different forms of capital. I think that this can be a very overlooked situation, and it's manifesting in very problematic ways. And I think that we do need to recognize that it is a lot of informal aspects and of our day-to-day lives. And because it's relying on these informal acts of services, that we do need to keep inserting our formal parts of physical architecture, our processes, our standards, and actually harmonizing these. So I do recognize, and I think that it's so valid and important about who you have in your life and that aspect. I do also recognize that that's a challenge, and it requires all these different complex components, and I just needed to say that.
Yeah. Thank you. Ainsley or Brittany, you have anything you'd like to say before we wrap up? No? Covered everything today. Well, we've covered a lot. I think one main point is we cannot paint everyone with the same brush. We need to make sure that self-advocacy is something people are comfortable doing and not being afraid to let those around them know that they are dealing with something that doesn't make them any different. They just may need some special attention or special needs in some ways. So I want to thank the audience, and I want to thank you guys personally for coming out. It was a great chat. And at this point, we'd like to send it back to Christiane for the wrap-up.
Thanks, Ryan. Great discussion today. We've heard some excellent recommendations. These recommendations will be included in a report that will be submitted to the Office for Disability Issues in the next coming weeks, and also in our final report, which will be available on our website in March of 2018. I'd like to thank all of our presenters and our participants all across the country and those who joined from the United States and abroad. For more information about the Spotlight Project, I welcome you to visit the Canadian Hard of Hearing Association website at chhha.ca. You'll find the Phase 1 report in both French and English, as well as recordings from all of our webinar consultations. There's also a survey online as part of Phase 2 of the Spotlight project. We encourage you to fill that out. If you have further thoughts on the discussions that were held today, or you have thought of something in the near future, please don't hesitate to share that with us through our website. So again, thank you for everything today, everyone, and thanks for joining. Thanks to the audience, and I wish everybody a wonderful day. Have a great afternoon.